This lady, Mrs. Trump, should be very worried about those lies. Now, findings from a joint study show there may be opportunities to develop a cure for HIV. Now, that's after a new study on 9 women from South Africa found that after being treated with antiretrovirals, they exhibited no detectable signs of the virus for a period of at least 4 years. Now, to discuss exactly what this means, I'm joined by Professor Salim Abdul Karim, Director of the Center for the AIDS Program of Research in South Africa, who was part of the study when it was being conducted, and he's in our Durban studio. Professor, good evening, and thanks so much for your time. So just explain to us what exactly happened in the study on those women.
Sure. Good evening, Yuveka. It's a pleasure to be here. So we know that when a patient who has HIV is taking treatment, antiretroviral treatment, it suppresses their virus. But should they stop taking treatment, even briefly, the virus comes back. Now, the question that we try to ask is, where is the virus that's coming back from? So we know that it's viruses that are deeply hidden in tissues that we call the viral reservoir. Now, the conventional thinking used to be that the viral reservoir gets its viruses when the infection first takes place and then continues to occur over many years. This study, which was looking at the viruses in the reservoir of 9 KwaZulu-Natal women and sequenced hundreds of viruses, what this study showed that in fact our conventional thinking is not correct. In fact, these women, 71% of their viruses in the reservoir were actually from the time that they started antiretroviral treatment. So that means that when we are initiating antiretroviral treatment, if we can add something, if we can do something to prevent those viruses from going into the reservoir, we have a better chance of leading to a cure. So while we recognize we don't have a cure, this research is not a cure, but it is one step towards the long-term goal of a cure.
Okay, so there are 2 things here, or 2 questions that come to mind when it comes to what you have found. One is, does the virus go away? Does it disappear? Or does it just remain undetectable? And then how, in that case, or how will this lead us to actually work towards a cure? And I know that you've explained it a little now in your answer there, but just does it mean, is it a positive or a negative, or a positive and a negative, basically, is what I'm asking.
Sure, Kathy. So the biggest barrier that we have in order to cure HIV is that we have not been able to clear the viruses that are in the reservoir. Those viruses go into the deep tissues. They are largely in lymph nodes and in CD4 cells that are resting. They are not, because the virus is not actively growing, the antiretrovirals can't get to them. And because they are hidden inside the cells, the treatment doesn't get to them. So what they effectively are, they're sort of like dormant viruses. But when you stop treatment, they come back. So we've been trying to find a way in order to cure a patient of HIV is to get rid of those dormant viruses. Sometimes they refer to as latent viruses. Latent meaning that they actually in like a sleeping state, but they can be woken up at any time and they can start growing. So when we have viruses in this latent state, then we want to ensure that we can clear them. The problem is that that's been almost impossible for us to do. So now, can we prevent them from actually even going into the dormant state? And that's what this research, this study with these 9 women, opens up a new door. It opens up a whole new approach to how we can think about a treatment. And we are now in the midst of thinking about all kinds of opportunities in order to tackle the virus at the time of treatment so that they don't go into this dormant state and go into this viral reservoir.
So, Professor, I suppose one of the challenges there would be, how do you know where to find them or how to find them?
Oh, so that's not a simple matter. But what we are able to do is we are able to take blood and we are able to look for a very specific kind of cell called a resting T cell. And in those resting T cells, we look for HIV. Now, they are sleeping in there, so it's very hard to get them. So we stimulate them. And in stimulating them, they sort of wake up and they start producing HIV. So our focus in this reservoir is to go to these deep cells. And we can't reach them, of course, they all are hidden away, but if we can sample a few of them from the blood, we are able to understand them in a great detail.
Okay, thanks very much for that explanation, Prof. And I wish you all the luck. It doesn't sound like it's any easy task ahead, but at least, you know, it gives you somewhere to look and somewhere to work from. Thank you very much for your time there, Professor Salim Abdul Karim.